Welcome to Canine Wellness Online Learning. Today's question from my client was, what is a cruciate ligament and what does it do and why do I care? So today I want to talk to you about exactly what a cruciate ligament is, what it does in your dog, and why it's so important. If you haven't already subscribed, please subscribe and like and share with your friends. So what is a CCL or ACL in humans? So CCL stands for cranial cruciate ligament. And what that means, cranial means in front, and cruciate ligament. And the reason they call it the cruciate ligament is because there's a cruciate caudally, so one behind and one in front. And they actually, inside the joint, make a cross. So it comes from the word crucifix. So the most important one and the one that gets injured the most is the cranial one, so the one in front. What exactly does the cranial cruciate ligament do? Essentially, it stabilizes your dog's joint, or in case of a human, it stabilizes our knee. And what its job is to stop, this is what's called the femur, and this is called the tibia. What its job is to stop the femur from sliding backwards, or effectively the tibia looks like it's moving forward. When your dog has a cruciate ligament injury, what you'll typically see, which I've discussed in other videos, is a dog that might be limping, toe touching, or in some cases holding it up. And the reason they're holding it up is because the joint isn't stable. So every time they go to put pressure on it, we get this movement backwards, backwards. So what does the ligament actually look like? I mean, we can look in videos online, but in my mind, it kind of reminds me of a bungee cord. So here I took a bungee cord and I actually took the outside out. And to kind of appreciate what it does in that joint is if we were to look inside, so this is the patella and the patellar tendon, but whoops. But basically what happens is it sits in here across like this. And it's a fibrous structure. And what happens is over time, sorry, I have not enough hands. But essentially what happens is we pull on it, we pull on it, we pull on it, and we pull on it, and it gets stretched. And you can see the little fibers, or the little bungee stringies, start to break down and break down and break down and break down. So this would be kind of similar to a partial tear. So a few of the fibers have broken down. And then we stretch it a little bit more and stretch it a little bit more and stretch it a little bit more. Obviously I'm overemphasizing this because this happens on a much smaller level. But essentially what happens is it starts to tear, and then one day, well, it tears completely. And that's what's called a full tear. When there's a partial tear, we have, as I showed you, some of those fibers have broken down. So the knee is still, it's not stable, but it's not fully unstable. So there's still some fibers holding it together. But when it fully tears, what happens is there's nothing holding or stopping this femur from sliding backwards, so we get all this movement in there. And that's the test that they do when they're checking to see if your dog has a full tear or a partial tear, is they're checking to see how much movement there is in that joint. So one of the other things that can happen, especially if they have a partial tear, is inside this joint there's two little C-shaped cushion pads, for lack of a better word. And these are called the menisci. And there's one that sits on this side and one that sits on this side. And they're basically the cushioning in the joint. So what happens is when that knee becomes unstable, there gets to be more movement in there, and it starts putting pressure on that meniscus. Typically, what can happen is that meniscus will actually eventually get a tear in it. And I can speak from myself, I had a meniscal tear in my own knee, is they're very painful, and it's because that little tear in there, every time they move the joint, it's hitting that little tear, and it's very painful, and it can get very inflamed, and it's probably, from my own experience, more painful than actually the unstable knee. So hopefully this explains to you in more simple terms, because that's kind of how my brain works, of what the cruciate ligament is, what it does, and its importance in your dog's knee. Stay tuned for more videos and like and subscribe. Thanks a lot. Have a great day.